Good morning. I, Dr. Monankita Sharma, would like to present my poster on unilateral vocal cord palsy in COVID-19 era. The aim of our study is to evaluate the various etiologies of unilateral vocal cord palsy in the COVID-19 pandemic. Coming to the introduction, unilateral vocal cord palsy is a common entity seen in ENT OPDs where the patients present to us with various symptoms like of hoarseness of voice, vocal fatigue, dysphagia, aspiration, and shortness of breath. It requires a detailed history taking, examination, and investigations to come to the diagnosis of the underlying cause. But the COVID-19 pandemic did bring many obstacles to the ENT specialist as it delayed the diagnosis itself and also henceforth prevented early intervention of the unilateral vocal cord palsy patients. Our study is an observational prospective study that included 30 patients who were diagnosed with unilateral vocal cord palsy on 70-degree Hopkins endoscopy at our tertiary care center. All consulting adults with presenting symptoms were included who were proved to be RT-PCR negative, and any patient with laryngeal malignancies were excluded from our study. A detailed clinical assessment was done that included a 70-degree Hopkins rigid endoscopy, which was done by following the proper COVID norms. We used betadine gargles 10 minutes prior to the endoscopy procedure. We also did a high-resolution computer tomography of the skull-base to mediastinum of all the patients. Voice assessment in the form of maximum phonation time and SZ ratio was done, and a transcervical ultrasonography of the larynx was done. The patients were followed up in the first, third, and 6 months. Coming to the discussion, the mean age of the patients in our study were from 42 years plus minus 14 years. The various etiologies that presented were of 6 were idiopathic causes, 6 were iatrogenic vocal cord palsy, out of which few were of total thyroidectomy patients and few were coronary artery bypass surgery patients. 1 was a case of skull-base osteomyelitis, 1 had GBS, 4 patients had a post-traumatic cause, out of which 2 were due to post-extubation trauma. 2 patients had a post-COVID-19 mucormycosis. Here I have shown the CT scan of a skull-base involvement of the post-COVID mucormycosis patient. 2 patients had thyroid malignancies, out of which 1 had a very large retrosternal goiter. 2 patients had central causes of infarct, where 1 was presented to us like a case of Wallenberg syndrome. 6 patients had mediastinal masses of mediastinal lymphadenitis. 2 of them were of post-tuberculosis lymphadenitis, and 1 was a patient of Hodgkin's lymphoma. In the view of COVID-19 pandemic, new protocols were developed to prevent professional hazards, out of which 70-degree endoscopy was the most troublesome for the ENT specialist, and hence, therefore, ultrasonography of the larynx served as an excellent tool in the place of endoscopy to see vocal cord mobility. 85% of the cases were diagnosed correctly on ultrasonography. The pandemic also limited our interventions, and all the patients were managed conservatively with speech therapy. Initially, a 2-room setup for audiology was used and the patients were taught exercises, and then telemedicine was used to follow up the patients. But 30% of the patients dropped out, and not all patients were compliant to the therapy. On the 6-month follow-up, 6 patients recovered from the palsy, 9 patients showed some cord mobility, 10 patients had persistent palsy, whereas 5 patients died due to the underlying diseases. Concluding, I would like to say that unilateral vocal cord palsy is a relatively common diagnosis in ENT OPD, but the COVID-19 pandemic did change its diagnostic protocols and also the management protocols. Also, newer diagnoses like post-COVID mucormycosis came into light. Proper detailed evaluation and timely management is of utmost importance in unilateral vocal cord palsy patients. Thank you.